my name is Fat, and today me and my teammates, Casey and Harpreet, we are going to meet later on, are going to demonstrate how to do dress up for isolation. We'll be demonstrating contact isolation, droplet isolation, and airborne isolation. And the aim of this short recording is just to emphasize the need for protection to avoid spreading infection. I'm going to start with showing droplet isolation. So droplet isolation is linked to diseases like influenza and mumps, where you cough or sneeze particles in the air. So what I need for droplet precaution is a gown. So I'm going to start by putting on my gown. Put my hands through and secure it in the back. Okay, then I'm going to go ahead and get my mask. And finally, I'm going to go ahead and get my gloves and make sure that I cover up my wrists. And now I'm ready to go into the room. Okay, so I step into the room and I do everything I'm supposed to be doing. And when I'm done, I'm going to walk over to the door, at least 3 feet away from the patient. And I'm going to start by taking off my gloves, pinch, pull it over, put my thumb underneath the second one, make a ball, throw it away. Then I'm going to reach for my mask, put it in the trash. Then finally, I'm going to take off my isolation gown. I'm going to pull from the neck, put my hand inside, making sure I don't touch the outside of it. Turn it into a ball, put it in the trash, and then I'm ready to step out. Then I clean my hands. And for rooms that have the anti-room, you step out, degown, and then step into the hallway.
Hi, I'm Casey, and I'm going to be talking to you about airborne isolation, and this would be appropriate for patients who are positive for tuberculosis, the measles, and also chickenpox. First, I'm going to be putting on my isolation gown. And then this type of isolation requires the N95 mask, which does require you to be fit tested for. And then I'm going to put on my gloves, and then enter the room. And so I'm in the patient's room. Once I've completed my patient care activities, I'm going to take off my gloves, one inside the other, throw it into the trash, take off my gown from the back, from the inside again, rolling it into a ball, throwing it into the trash, and then finally take off my mask, use some hand sanitizer, and like with droplet isolation, I can do this in the anteroom if there is an anteroom.
Hi, my name is Harpreet, and I'm going to talk about contact isolation. Contact isolation is used for patients who have infectious diseases that can spread by direct contact, like MRSA, VRE, and C. diff. Okay, so these infections can spread either via direct patient-to-patient contact, or they can spread via objects that the patients use. So for this, I'm going to wear a gown and gloves. For contact isolation, you don't have to wear a face mask or an N95 face mask. Okay, so I'm dressed up in a gown, and then I'm gonna wear gloves I'm gonna make sure that I cover my wrists as well. Okay. Then I'm gonna enter the patient's room and do the procedure. And then when I'm ready to leave, I'm gonna roll up a glove, and then I'm gonna use the inner side of the other glove, make it a ball, and dispose it off. And then I'm gonna take the gown, I'm gonna rip it apart, and I'm gonna make sure that I only use the inner surface that's clean. The outside of the gown is dirty. I'm gonna make a ball all on the inner side and dispose it off. Wash my hands or use the sanitizer. Okay, this is how we do contact isolation.
So these are the 3 types of isolation that you will see in the hospital. We hope that you've learned how to properly gown up and also remove this isolation gear. It is important that you enforce these rules and also encourage others to do so in order to provide proper care for your patients and also for yourself.